Welcome back to My Children's Chronic, but I'm Iconic. Today, we have the incredible mental health researcher, Shenitta M Anderson, joining us today. With her expertise and unwavering passion, she'll take us on a fascinating journey into the world of mental health research, uncovering groundbreaking insights and shedding light on the complexities of the human mind. Get ready to be captivated as she shares her knowledge and experiences, leaving us inspired and hungry for more. So, grab your headphones and let's dive in to this enlightening adventure with extraordinary Shenitta M Anderson. My name is Royce Me, and I'm the one that runs My Trauma's Clinic by Iconic.
Lovely to meet you.
Lovely to meet you too. Are you ready to get started? Or do you
Yeah,
want to...
yeah.
Okay, perfect. So, let's get started. What sparked your interest in mental health research and led you down this path of studying and understanding the complexities of the human mind?
Yeah, really good question. So I think from an early age, I was always interested in kind of understanding people's behaviors and patterns. So I think my first kind of career interest was to be kind of a social worker at the start. And then I went to kind of a career event, and this kind of lady said, you should want to be more than a social worker. And I think she kind of had a bit of a stigma around kind of social working and kind of thinking it was maybe a bit low paid. So I then studied psychology at A level to kind of see, if is that something I'm really interested in? And from that, I was like, wow, this is really interesting, being able to understand people's mental health and kind of inequalities, but also kind of the theory around mental health to kind of back up people's kind of illnesses as well. So kind of from that, I wanted to kind of be a clinical psychologist. So to be honest, at first I wanted to be it because I seen the pay and I was thinking, oh yes, a job that pays well, I would love to get more money. And then I think once I started working in the NHS and I met a lot of clinical psychologists, I realized that even though some people get paid, a good amount of money, it's a lot more than just the money behind the job. It's really about helping people and understanding kind of the issues that people have faced from childhood, but also through adulthood as well. So I think kind of growing up, I've always known I've wanted to be in a role where I'm looking after people, but also understanding kind of mental health as well.
Can you tell us about a significant research study or finding that had a profound impact on your understanding of mental health?
Yeah, definitely. So currently I work on a project called CAFI for short. So it's the Culturally Adapted Family Intervention Project. And this project is around kind of people with schizophrenia and psychosis from Black populations. So that includes kind of sub-Saharan African and Caribbean populations and people who kind of identify as Black British. And in that research, it looks at how oftentimes people from a Black background can be 8 times more likely to be diagnosed with schizophrenia. And I think for me, when you hear a statistic of 8 times more likely than their counterparts to be diagnosed with schizophrenia, it does kind of bring a level of concern to understand, well, how is it that one population is more likely to be diagnosed with a mental illness than others? I think for me, working on that project that I'm on now, it's really made me want to understand, well, what is the barriers in people being diagnosed with mental illnesses, but also the cultural aspect as well. And oftentimes we're told that Black populations and ethnic minorities are kind of classed as a hard to reach population. But research has shown that oftentimes people from those ethnic backgrounds are actually 4 times more likely to be trying to contact mental health services, trying to get that support because of the barriers systemically due to kind of racism, stigma in the culture. Oftentimes their voices are not heard and more likely to be overrepresented in the police or criminal justice system, but also kind of the medium secure psychiatric units and kind of more likely to be given medication as well.
How do you approach your research to ensure that it's inclusive and representative of diverse communities and experiences?
Yeah, so I think first off, it's important to look at the current issues within society to understand kind of what is actually being impacted around people's mental health. So a big part of the project that I'm currently working on is this idea of co-production. So understanding that it's important to get people with lived experience into research to understand, well, what actually is the problems within mental health. Because I think when you're coming at it from a research perspective, we can read all this literature and read all these theories, but if we don't have a personal experience with mental illness, maybe depression, anxiety, maybe more severe, so kind of schizophrenia, psychosis, yeah, kind of all those type of things, it can come very biased in understanding how we actually research mental health. So I think it's very important to really get people with lived experiences from ethnic minority backgrounds to help shape research, if that's helping you understand kind of what's going on in the local community around that issue, but also to help you write funding applications or even just reviewing your research. So on the project that I'm working on, so the CAFI project, the culturally adapted family intervention project, they worked with service users with lived experience for a numerous amount of years on that project to understand how the therapist on that trial should be trained to have more cultural awareness, but also understanding just the language around mental health. So oftentimes clinical language or NHS jargon, as some people might say it, is not always understood by people from ethnic minority backgrounds. So it's really important to understand even the simplicity of language and how we're using terms of mental illness versus mental disorder and kind of how that can impact people. So I think it's really important to not only understand it from an academic background, but also to get people's experiences from that lived experience and get their voices into research as well.
What are some of the common misconceptions or myths about mental health that you've come across in your research, and how do you address them?
Yeah. So I think a big thing for me, so my research tends to be looking at kind of ethnic minorities. So obviously looking at around schizophrenia, psychosis, and then my PhD project is around kind of religion and spirituality and how that impacts people's recovery. And I think for me, one of the really big issues when trying to study populations, if even if they're not ethnic minority, is that stigma around mental health and understanding that oftentimes culture does play a role in how mental health is viewed by people. And oftentimes, the less people might be less likely to take part in research due to the cultural stigma of oftentimes thinking that people in the local community are going to find out about their mental illnesses, but also the stigma around kind of generational trauma. And oftentimes, for many, many years, diagnosis of kind of anxiety, depression, those type of things have been seen as a cultural taboo. And oftentimes, as people who are from ethnic backgrounds, we've not been brought up in a society where it's been okay to talk about mental health. And because of that, people are quite shy or quite scared to talk about mental health due to the consequences that they think are going to happen. So I think oftentimes, because of that stigma and that negative connotation, you have people who are maybe have a diagnosis of schizophrenia who have often been labeled as, the crazy person or the person that no one understands. And if we're being brought up in a society around those kind of very damaging terminologies, it kind of makes sense why people are unlikely to speak about their mental health and are more likely to take medication because it's easier for you to take a medication that looks like a paracetamol or ibuprofen and no one asks you any questions about it rather than you open up and saying, I'm going to therapy or I'm currently in an intervention. So I think for me, in my research, the really big issue has been kind of the stigma, and overcoming that is just by having these open conversations, having podcasts like this, having blogs where people can access information and hear from people that look like them. It's also really important to have that representation as well.
Definitely. I feel like the one thing that the NHS lacked, especially in the mental health um, sector of it, is a lack of representation, both in inpatient services as well as outpatient services.
Yeah.
How do you see the intersection between research and practical application in improving mental health support and treatment?
Yeah, so I think for a long period of time, the two disciplines were very separate. You had researchers who were based in universities, and then you had clinicians that were based in the NHS. And oftentimes there was no link between the two. And I think for many years you could very much see that there was a lot of research, but if you were to ask clinicians how that research is relevant in their practice, oftentimes it wasn't applicable. So I know for Greater Manchester Mental Health Trust, the research department have been very, their main focus is involving researchers in clinical settings. So there are new roles called a research nurse, for example. So this is a nurse by profession who will have her own or their own caseload. They will see their patients, but they will also have 1 day a week where it's based on research. And this is where they can do research in their current role and also kind of looking at the implications of things that they see in a clinical setting and how that can be researched. And I think it kind of leads back onto how what we discussed at the first question, this understanding of this co-production. It's really important to have people not only from lived experience, but also people from lived expertise, kind of that professional background. And I think for us, definitely having people in our research that are not only people with lived experience and carers, but also people in the criminal justice system, so police involved in shaping our research, but also care coordinators, therapists, psychiatrists, to really understand what is the practical application of our research, this intervention that has been culturally adapted, but also how does that look in a research setting. So I think it's very important to not only understand the research behind a subject or a mental health disorder, but also what does that look like in actual practice? What does schizophrenia look like for someone with a Black heritage? What does that look like for someone who not only has a mental health disorder, but also has children and a job, things like that. So I think it's very important to be working, connecting with not only researchers, but professionals as well.
What advice would you give those who are considering a career in mental health research and want to make a positive impact in this field of work?
Yeah, I think it's very important to understand, firstly, why you want to be involved in research, because a lot of people don't know that there's many different careers that you can still be involved in research. So you don't have to just do a PhD and stay as a lecturer or a professor, but you can be a psychiatrist and have research days. You can be a nurse and have your research days as well. So I think for someone who's interested in research, it's understanding what is your motivation behind that. Because as we all know, if you don't have a motivation or a passion, that burnout and that frustration and that kind of tiredness will eventually catch up to you. And I think it's very important to be very self-reflective, understanding the career paths that you can take. So if you're someone doing A levels or in university, really speaking to your career advisors to understand, well, these are my passions, and how can that lead me into a career that will sustain me for a long period of time, but can also be about research as well. And I think for me, if I was to kind of give myself advice, it'd be to make sure that you have a support system around you that can help you with that career as well. Because I think, especially when you're doing research or if you're working in a kind of clinical patient setting, oftentimes you're seeing patients that have got quite severe diagnosis, they've had quite a lot of trauma. And I think it's very important for yourself to be aware of how that impacts your mental health as well, because oftentimes I'm kind of doing interviews with people who have had really hard times in the criminal justice system and were sectioned at a very young age. And seeing someone who is the same age as my brother who's been sectioned, seeing that kind of impact can then have an impact on my mental health. And I think it's very important to be interested in research, but also understanding how that research impacts your own mental health as well. So I think it's definitely important to understand your passions, understanding kind of what degrees and what courses are out there, but also understanding that, as I said, that research isn't just a PhD alone. You can still be working very clinical, patient-facing jobs and still have research hours. I know kind of in social work settings, they are having more social workers that are more focused on research as well. So there's a lot of avenues there for people who are interested in mental health research.
Perfect. Why is mental health so crucial in today's society?
I think mental health is really crucial. I think it's always been crucial, but I think we're now more aware of the impact it's having on people. And I think the mental health kind of disorders, illnesses, however you kind of categorize them, have always been there. But I think we're now more of an educated society and we're having more open conversations about mental health. And I think it's very important just to understand your own mental health in the beginning, even if it's not a formal diagnosis of anything, but we all suffer from mental health symptoms, regardless if it's a formal clinical diagnosis or not. And I think it's very important to understand how that impacts your life, but also we're working more around people now. We're working on more online platforms. So oftentimes people are doing a lot more Zoom meetings or Microsoft Team meetings. So we're more likely to be around different types of people and connecting. And I think it's really important to have an awareness of mental health and how that impacts people, how their upbringing impacts people, the things around them, their environment. But I think it's also important to just be more aware of how we communicate about mental health and being the voice that we wish that we heard when we were growing up and we were more comfortable to talk about mental health. And I think we're more likely to speak about mental health, so people are getting diagnosed at a lot younger ages, which can be very helpful for people to kind of come to terms with the things that they've been experiencing as well.
Can you elaborate on how mental health research impacts the development of effective treatments?
Yeah. So, in terms of mental health research, oftentimes you are researching, studying things that are brand new. So, oftentimes within research, there's kind of guidelines that you need to be researching something that is new. And that doesn't have to be a groundbreaking new research, it could be a small change. So, for example, if a drug research project has only been tested on white males, it would be very important to test that same drug on Black females, for example. So it's really important to understand the gaps in the research, but what also that literature is saying at the moment. And then looking at how that impacts people and how the research out there can really represent the issues that people are facing. So I think it's not only important just to look at the research that's out there, but also kind of what that says for people currently. Could you just repeat the question as well, just so I cover everything?
Um, what are oh, let me think of it. Sorry. Oh, uh, can you elaborate on how mental health research impacts the development of effective treatments?
Perfect, yeah. So yes, as I mentioned, kind of looking at the literature, but also with research, it kind of shows what's been done before. So with our interventions, for example, family intervention, so that's been argued by kind of the NICE guidelines, the National Institute of Care Excellence Research, looking at how family intervention, so involving people's family in research, is really important. And studies have shown that this interventions with your family can help reduce schizophrenia and psychosis in patients. But this has only been looked at in small populations, in quite affluent areas, and oftentimes on white families. So that shows that one, family intervention is effective, but it's that gap, it's not been looked at on Black, African, or Caribbean populations. So, with that knowledge, researchers can then look at an intervention and say, okay, well, what's worked well for one population, but what needs to be tweaked so it has cultural awareness. So, understanding what interventions have been done previously can then be looked at in a clinical setting. And as I mentioned, when you're looking at an intervention, looking at what works well, but also asking clinicians, well, what does this intervention look like in a clinical practice? What does family intervention look like in an NHS service? What does therapy look like for someone who's actually coming into that service and receiving that care? And then looking at the theory behind the intervention. Well, why was it created? Why is it only 10 sessions of family intervention and not 12? Why are the sessions an hour long and not 2 hours? So it's really important to understand what does that look like in a clinical setting and asking for kind of that clinical feedback from people who are actually delivering that intervention, but also asking service users that are experiencing that intervention, how does it help them? So that is often times when you're in an NHS service, for example, you'll get those little evaluation forms and they ask you kind of what was your experience in the NHS? And I think when you're a patient, oftentimes you think, oh, well, why do I need to fill out this evaluation form? You know, it's very stressed. I'm already stressed. Why do I need to fill this out? My voice is not heard. But the more people who do fill out those evaluation forms, that does help shape research and does help shape interventions and how we deliver services across the NHS. So I think oftentimes, even though the form might only take you 5 minutes, your voice is being represented and change will eventually happen.
What are some of the key research methods used to study mental health?
Yeah, so there's a different range of research methods that I use, and we kind of use these umbrella terms of qualitative and quantitative research. So, qualitative research looks at the quality of the research. So, this is where you're going to get your interventions, you're going to get your interviews, so semi structured interviews and structured interviews. You're going to use your focus groups, and it's really looking at using people's voices and lived experiences to understand research and what that researcher is looking at. Where on the flip side, you have your quantitative research, where this is focused on the quantity of research that you're gathering. So this is looking at gathering large amounts of information. So this is where you're going to get like your surveys, for example, so your questionnaires, your kind of statistical research. And I think the difference between the two is how I've always kind of learned it growing up doing psychology is quantitative is based on numbers. So that's where you're asking people a lot of questions on a questionnaire to analyze it statistically. Whereas qualitative research, oftentimes you're looking at the person's voice, that lived experience, and you are using more conversation styles. So, a conversation like a podcast, for example, would be a qualitative method. It's a conversation where you're trying to understand that person's perspective. And oftentimes, qualitative research, you'll often have a lot of a smaller sample size because you're going to be getting a lot of richer data from a conversation that's an hour, 2 hours long. Whereas with quantitative research, because it's a questionnaire, you'll have a lot of a larger sample size because it's quite easy to hand out questionnaires and you're looking for a statistical power between that information. Different researchers you'll have researchers who only look at qualitative methods in their research. You'll have people who are only based on quantitative. And then you have people who kind of sit in the middle, who see the importance of both of them and are kind of a mixed methods researcher. For me, my background has been more qualitative. I do enjoy having conversations. And I think when you're speaking about mental health, even though there are fantastic research studies that use quantitative methods, I think it's very important to understand people's lived experiences and allow people to have that space to tell their story and to have an interview where you can have these conversation based to really have an understanding of their mental health. But as I mentioned, there's benefits for all three of the research methods types. And I know we'll kind of come up about the benefits in a later bit.
How do observational studies contribute to our understanding of mental health conditions?
Yeah, so observational studies is where researchers will observe a mental health kind of research kind of project. So, for example, if you were looking at depression, you might have a researcher who will go into a clinical setting and observe kind of what it's like to live with depression in an inpatient setting, for example. I think observational studies are quite helpful because it allows you to observe someone who's actually experiencing that mental health, or you might have a researcher who observes interventions. So, for example, different therapies that are delivered. So it's that kind of first-hand experience of what that intervention, what that research, what that disorder looks like in person. And with every research method, there's always going to be biases, there's going to be limitations. But I think the importance of observational research is that you're being able to observe it firsthand and kind of be that fly on the wall or that bird looking in at that scenario, for example. And it can really be very beneficial to kind of see it from someone else's perspective, kind of the researcher putting on the patient's shoes and seeing it from their experiences.
What role does clinical trials play in advancing our knowledge on mental health conditions and treatment options?
Yeah, so clinical trials at the moment, there's quite a lot of them going on. So clinical trials really helped with our understanding of the impacts of COVID, for example, on people's mental health. And during COVID times, we're getting a lot of research that was looking at the clinical implications of COVID and how that impacted mental health. So, oftentimes, researching how us being in lockdown and kind of that isolation had an impact on people's mental health. For some people, they found COVID really helpful, other people didn't. And I think with clinical research, because it's such a robust structure, so you have to go through a lot of paperwork, a lot of applications, a lot of ethics kind of procedures. Oftentimes, clinical research is done at a quite high level. So you'll have kind of drug researchers, so looking at the impacts of a medication, but also you'll have clinical intervention, so maybe a family intervention, a therapeutic model, and with clinical research. So the one that I'm looking at is a clinical research on a family intervention that's been culturally adapted for people from Black populations for schizophrenia and psychosis. With that research, we're looking at it in a clinical setting. So we're looking at schizophrenia in inpatient settings, in the community settings, but also in forensic settings. So these are kind of medium secure psychiatric units as well. And because of the funding that people get on clinical trials, you are able to look at a lot of different aspects of that research and test the kind of intervention's effectiveness as well. So I think with clinical studies, they really do have a lot of quite highly skilled people on that research that are able to help understand it. But also with a clinical study, you're going to have a lot of clinicians also involved in that research. So understanding how that intervention looks in clinical settings as well. So that clinical application, but also reviewing the current services that are being accessed by people in that clinical setting. We're able to shape research to understand what do we need to improve with our current services that we're delivering to service users or people accessing the service, but also what needs to change. And with that, these clinical researches are kind of written up in reports and oftentimes are available through an open access report. So that's where it's open access for anyone to view the research project, and that can then help shape policies, but also help shape how the service is currently being run as well.
How do longitudinal studies help researchers track the long-term effects of mental health interventions?
Yeah. So longitudinal studies kind of, it's in the name, it's a long study. So that's often where you follow the same participant for a long period of time. So there are some studies that will research an area for 10 years, 5 years, 2 years, quite a long study where you're researching that one participant, asking them similar questions over a long period of time. And I think the benefit of longitudinal studies is that it's not you're meeting someone for the first time, you ask them your research questions, and then you base whatever you find on that one day on how they're currently experiencing mental health or research, but you're following them over a long period of time. And I think, as we all know, we'll all have good days. We'll have a good day and we'll have a bad day. Whereas longitudinal studies will look at the good and the bad of that whole person's experience for that 1 year. So I think it's really quite exciting that we are having more longitudinal studies. But with longitudinal studies, there are quite a lot of limitations in terms of you're following one person for a long period of time. And we all kind of know the easiness of changing your phone number, for example, or oftentimes people change location. So it's quite difficult oftentimes to recontact that service user when you want to, see them again. So, for example, if you're doing a longitudinal study of 2 years and you're looking at the role of the environment on people with depression, you would have one participant and you might meet them 3 times in the year, for example. And you'll probably do the exact same questionnaires with them or a similar interview structure. That would therefore mean that you're meeting them 3 times for 1 year, 3 times for the next year. You have to find a way to kind of keep in contact with that person. So that can be quite challenging. But also, if you're looking at it from your own experiences of mental health symptoms, for example, your life can really change in 2 years. And it's really nice to know that research can actually look at how, for example, depression has changed over those 2 years, looking at the positive impacts, the negative impacts. And I think because of how successful longitudinal studies can be, the findings are very robust because you've looked at someone for a long period of time. It's quite challenging to do longitudinal studies, but the actual results are really fruitful as well.
Are there any specific challenges or ethical considerations unique to conducting research in the mental health field?
Yeah, definitely. So I think with mental health, oftentimes people who've been given a diagnosis, there can be a lot of trauma around that. And we kind of view these people as quite vulnerable people because they've been through a lot. They've experienced trauma, they've experienced kind of stigma, maybe some racism as well. Like they've experienced a lot of things. And if we're doing research, we were very interested in understanding people's lived experiences and how their mental health has impacted them. But at the same time, you don't want to re traumatize someone. And we are very aware that topics like mental health can be very triggering to people. And even though conversations are key and awareness is key, oftentimes can be quite hard to do interviews with people without re traumatizing people. So I think it's very important as researchers to have things in place to support people's mental health while you're researching them. Because even though as researchers we want to improve people's mental health, we also need to understand at the end of the day that that is a person. That's a person with lived experience. That is a person that has been through a lot. And even though research can be very beneficial, at the end of the day, we want to make sure that each individual has felt supported whilst being researched and they don't feel like they're just being re traumatized and all this information they're having to relive and then they're just being left. So I think it's very important for researchers, even clinicians or people, if you're talking to a friend or whatever, to understand how this conversation can impact people and having conversations like a podcast or an interview where you ask people at the start, we're going to be talking about a few sensitive topics, if you do need a break, for example, or if you do need any support systems, but also after we do research, we have kind of debrief sessions. So this is where we try to de-escalate any kind of trauma we might have brought up, but also being aware of our own backgrounds as well. So I'm a researcher by background, but I'm not a clinical psychologist. So I don't have professional backgrounds to give you mental health advice, but I can signpost you to clinicians. So it's really important to understand within research, this is quite a sensitive topic, but having kind of support after that research is really important. Having those helplines, having a space where, patients, service users can just process what they've actually talked about and understand that their voice is going to be heard and really involving them in the research as well is really important.
Can you we discuss the significance of cross-cultural research in understanding mental health disparities and developing culturally sensitive interventions?
Yeah, so I think it's very important to not only look at mental health from one population, but also to look at how that impacts different cultures as well. So, kind of a culture is a way of life, a way that someone kind of expresses their identity and can also kind of link into their ethnicity or their racial background as well. And oftentimes, understanding that just because someone, for example, is from the Caribbean, understanding that each different island in the Caribbean has a different way of life, has a different cultural background. So the intervention might work in one island, but doesn't work in another. So it's understanding how different cultures work and also how interventions can help. So, for example, on the culturally adapted family intervention project, we're looking at the family intervention and creating it more culturally aware. We're looking at that through populations of Caribbean descent, but also African descent as well. So they're two massive, one island, a continent. Looking at how one intervention can help people is going to be very difficult. Understanding that in each country, there's different like cities in that country, and each person acts very differently, and mental health impacts people very differently as well. So it's always important to, when you're doing intervention research or kind of creating a new research project, is looking at it through different cultures. But also, as I said, mention kind of that co-production. So we took many years of before even kind of putting the intervention out as a research project, we worked with community champions. So community champions are people who are well established in the community, and so these are people who have really good connections in the community. And we use them to understand, well, this is the intervention currently. This is how family intervention is run. This is the different modules that people do in the therapy room doing family intervention. How is this culturally aware? So oftentimes when we were reviewing the materials, people from the Caribbean culture, for example, found that the language used was not applicable for their culture. And people from African countries as well, kind of they found that the information around kind of family was not similar. So, for example, oftentimes in some cultures, the role of the grandmother is very important and they're kind of seen as the head of the family. Whereas other times you'll have other cultures where males are seen very important, or you'll have kind of cultural backgrounds of where different ways to treat males and different ways to treat females. I think it's very important to look at the way that a culture is in that community, and then using that awareness and that knowledge to shape research. Once you then culturally adapt an intervention, and that's really looking at working with people from that culture, it can then become more culturally sensitive and having that awareness, but also understanding that there is no cultural adaptation, there is no cultural awareness that will ever allow someone to really understand that way of a culture. But it's just being more aware of how culture impacts people's mental health and therefore can create more culturally sensitive interventions.
What are some innovative research approaches being used to explore the connection between mental health and genetics?
Yeah, so I think there's definitely a lot of biological interventions. So looking at research from a biology perspective, so a lot more kind of brain scans and kind of testing people's DNA as well to see kind of are some of the mental health disorders inherited from family members. And I think it's quite interesting because oftentimes disorders like schizophrenia, for example, can be inherited from a grandparent, someone in your family, but oftentimes maybe because you have a gene that might make you more likely to develop the disorder, understanding that that does not mean that you are 100% going to experience depression or anxiety or schizophrenia. But I think it's important for people to know from a young age. So if there are more research projects that are looking at people in, for example, with schizophrenia, their family tree, and understanding, did their mum have schizophrenia, their dad, going down that family tree. I think it's a good information for people to be aware of. Because then oftentimes, if I, for example, knew that my mum, for example, had schizophrenia, and that was spoken a bit more earlier on my development. So if doctors would make children more, or kind of at an appropriate age, more aware that, you do have this gene that makes you maybe more likely to develop schizophrenia, it can then help people put things in place, protective factors in place to help them kind of develop without kind of the shock of being diagnosed or sectioned. And I think when you're looking at, is this disorder kind of inherited by a family member, it can really help you create those protective factors as well. But also, I think it would be quite helpful for people who are trying to maybe have children as well to understand kind of any disorders, any genes that they might have in their family line, because that can then help them kind of shape their families as well. But I do think it's really important to understand at what age, at what point do we have those conversations with children or young adults to understand the things that might be inherited from their bloodline as well.
How do epidemiological studies contribute to our understanding of the prevalence and risk factors of mental health conditions?
Yeah, so this is not necessarily my area of research, but I am kind of aware of it. And I think it's really important to understand kind of people's kind of DNA and kind of that medical kind of biological systems, as I mentioned, to kind of therefore help mental health, and understanding that oftentimes if, for example, people have a mental health disorder in their family, understanding how diet, but also kind of the environment around them can then also impact their mental health. And I think with research, it's all about that knowledge and understanding what's out there currently in society. Also, what are people currently living with? And with that, we can then therefore make more interventions that are a lot more sensitive to them. Also, it's all about being more person centered and understanding that we might do research in one area and these findings will produce a certain finding, but understand that every individual is different and understanding kind of how that impacts people as well.
Can you provide examples of collaborative research initiatives that have made significant contributions to the field of mental health research?
Yeah. So in terms of kind of the field of research around kind of schizophrenia and psychosis, so there is one study, that the one that I'm working on, that's looked at people with the schizophrenia and psychosis. And we worked collaboratively with people with lived experience. And we kind of use it as an umbrella term. So that could be service users, carers. They have that lived experience of the mental health. Also, we looked at people as well with lived expertise by profession. So that's people who would be involved with people who are experiencing that mental health. So, as we mentioned, oftentimes Black populations are 8 times more likely to be diagnosed with schizophrenia and are more likely to have police involved in their care as well. So, it's important to have, therefore, police officers involved in shaping that research around people with schizophrenia and psychosis. So, we had people from the police institutes, we had academics, we had clinicians, so your clinical psychologists, counselors as well, and having this kind of consensus conference. So this is where you have representatives from each different type of lived experience, either by profession or kind of by personal experiences as well, in a room, and you help shape that research. But also, there's also research where we're now having more people with lived experience actually running research projects. So within the research department in Manchester, we have one project that's looking at schizophrenia that is run by someone who has actually experienced schizophrenia and hearing voices. And that's been really helpful because not only are you having someone with that academic background involved in research, but also that lived experience as well. And I think it's very important to work collaboratively with people who've experienced the lived experience of that a disorder, but also people from academics as well. Because I think oftentimes if you're from an academic background and you have no experience of the research that you're currently researching, so for example, I research schizophrenia, but I haven't had a personal experience of schizophrenia symptoms. If I was to just do that research by myself and not work collaboratively, my research would be very biased and very much based on the literature rather than practical application. So I think working collaboratively doesn't or not only just mean work with people who look like you, but also people who actually experience that mental health, who are actually in the local community as well. And I think once you get that information from each different person, the information can be a lot richer and a lot more reliable as well.
Can you share some fascinating research insights on the relationship between genetics and mental health conditions like schizophrenia or bipolar disorder?
Yeah. So there is a lot of research that looks at kind of how schizophrenia oftentimes is genetic. So sometimes if you have someone with who have experienced schizophrenia, you're more likely to then experience it. For example, if you were their child, or oftentimes a lot of twin studies where if one twin has been given diagnosis for like bipolar or schizophrenia, their twin is also more likely to experience it as well. So oftentimes a lot of genetic kind of research was done a lot many years ago on twins because twins they share pretty much the same genetics. So it's quite easy to look at how one gene impacts one twin and therefore will impact the next twin as well. And I think it's quite important to look at this kind of biological side of research because oftentimes if we can see particular genes that people have, it can therefore help people create these protective factors. So oftentimes, for example, in terms of sickle cell, we know that there's a gene that you can see where you're more likely to be developing sickle cell. If you then know that you have this, you can then start putting preventative methods in from a lot earlier and a lot younger, which will then help you manage if you then do develop that sickle cell. And that's why you can have people who are a carrier of sickle cell. They might only have one of the carrier genes, they might have both, for example. And then therefore, if someone knows that they are a carrier of that sickle cell gene, it can therefore help them understand when they are creating a family and understanding, well, if my partner also has a sickle cell gene and I also have one, do we want to kind of have children? And you're more than welcome to have the children, but understanding having those things in place from an earlier on that you can help that child is really important. So being able to understand gene research and kind of that biology side of it can then help people create more systems in place, more protective factors so that they can really experience the full potential of life as well.
What recent breakthroughs or promising research have you come across in the field of anxiety disorders, such as, generalized anxiety disorders or social anxiety?
Yeah. So there is a research currently being developed around kind of anxiety and kind of social media. So oftentimes we know as a society we are more likely to be on our phones and a bit more tech savvy. And oftentimes this can really help people with their social anxiety. And oftentimes research looking at kind of COVID implications on mental health disorders such as anxiety found that there were actually people who found it really helpful to have platforms like meetings on Zoom, interviews on Zoom, and things like that to really help them with their social anxiety. So research has shown that people with kind of anxiety have benefited from more online platforms. And with this research, that's how you're now seeing more jobs that have more remote working. So we are now creating more jobs where you can work from home and you might only have to come into the office once a month, for example. And having more remote jobs and having more interviews online is really a product of research that has been done on people with, for example, anxiety. It's because the research has shown that having more accessible platforms for things such as having an option to have an interview online can help people reduce their anxiety. And that's why we're also creating more interventions looking at the use of technology to help people. So that's why in some cultures you find restaurants where you can order on your phone. Oftentimes, people, when you see different changes in restaurants, you don't realize that that's because of research. So oftentimes when you're now going into a restaurant, for example, you can scan that QR code. Research has been done to show the accessibility of having that option to not only order in person, also to order online can help people with, for example, social anxiety to kind of, they don't have to be as patient, as public facing as often they had to be before. So I think society, due to this isolation, has really shown, research has shown that having more accessible things, such as more things online, has helped people with anxiety as well.
Can you shed some light on research surrounding neurodevelopmental disorders like autism spectrum disorder? And what are the recent findings that have enhanced our understanding of these conditions?
Yeah, so there's research currently kind of being developed now by a PhD student looking at kind of autism in Black children. Because oftentimes autism was researched by a lot of white children and didn't have that cultural awareness of the kind of symptoms of autism. I think oftentimes this research that's currently still being developed is looking at how autism is expressed in Black children and how that's different from oftentimes white children or white counterparts who that kind of symptomology or the guidelines of the diagnostic manual is being based off. And this is really interesting because, as we mentioned, being more culturally aware of research and being culturally aware of how symptoms can be expressed in different people is really important. Understanding that autism might look like one way for one child, but can be very different in, for example, a Black child. So research looking at not only the mental health or kind of the disorder or diagnosis in general, but also looking at it culturally has been really impactful in how clinicians therefore can see the symptoms in different children or in adults, for example, and that can help with people being diagnosed a lot earlier, but also will then reduce the likelihood of misdiagnosis as well.
Um, Perfect. I think I'm going I don't know if you're following the outline or not. Are you following the outline?
Yeah, I've got it on my phone. Yeah, the
Yeah.
questions. Yeah.
I feel like we covered a lot of part four.
Mm-hmm.
So I'm just gonna cut that whole section off. Make it easier for you. Um, okay. So how do genetic factors and environmental influences interact to shape an individual's mental health?
Yeah. So there's research recently that I was in contact with a colleague actually, who was looking at how COVID and kind of mental health has been shaped by environmental factors. And it was quite interesting actually, because oftentimes we are products of our own environment. And, we have our own routines, and oftentimes, for example, like pollution can impact your mental health, also kind of the environment you are around. So, kind of the people, also kind of food, and also your hobbies as well. And I think it's very important because oftentimes we can be very aware of things that are happening in our environment that can kind of be very triggering. So, for example, when my microphone was very crackly, oftentimes that can be a lot of kind of feedback for someone, and that can really impact people's concentration, but also mental health as well. So that is an example of how your environment can be an impact of, for example, your mental health. And I think it's also important as well to have that awareness of your environment and how that impacts your mental health, and understanding what environments you feel safe in, also understanding what environments can trigger people. And oftentimes that is why there's been a lot of research in terms of understanding the therapeutic actual room, so therapy rooms, and how just the simple layout of a therapy room can impact how people are more likely to be involved in that research or more likely to engage with a therapist. And that is why you'll find oftentimes therapy rooms are very much changing from that standard, a chair in the room, a sofa, and you have the therapist there writing down notes, to be a bit more brighter room. So having kind of that color theory, for example, in a therapy room, kind of changing that environment to make people feel safe, And oftentimes we do research on people, for example, who have had quite a lot of bad experiences in the mental health service. So if, for example, you're doing research on someone who's experienced a lot of racism in a mental health service, being aware of their environment would therefore allow you to understand it wouldn't be appropriate to then ask them to come to do an interview in a clinical setting, because them even walking into a hospital can oftentimes re-trigger kind of traumatic memories as well. So oftentimes your environment is where you spend a lot of your time. So that has a really big impact on mental health symptoms. And that is why oftentimes some people can be very kind of experience worse symptoms when they're in environments that remind them of a traumatic event. And I think it's very important to just be very self-aware of everyone's environment, understanding what environments you feel safe in, what environments you don't feel safe in, and what is it about that environment? Is it the people in there? Is it the color scheme? Is it the amount of kind of things that are in there? And I think the more we do research on environmental impacts on people's mental health, will therefore allow us to adapt our research to be a bit more inclusive for people, and understanding that it's very person-centered as well. So everyone is different, everyone experiences environmental impacts differently, and looking at how we can research that to have a bit more of an awareness as well.
Can you elaborate on the role of epigenetics in understanding the complex interplay between genetics and the environment in mental health?
Yeah. So oftentimes we look at, as I mentioned, the environmental impacts and also genetic impacts of mental health. But understanding that if, for example, someone has a gene, for example, for a mental health disorder, their environment can play a very big impact on them actually experiencing those symptoms. So, for example, if let's say you've had a bloodline where your family have had schizophrenia, for example, and you've not experienced or been given a formal diagnosis of schizophrenia yet, or you might not yet, but you know that your mother, your father, siblings, relatives have experienced schizophrenia, oftentimes it's very important to be aware of your environment. So research shows that oftentimes people who have a gene for a disorder or a, a mental health or a physical disorder, maybe like sickle cell, if their environment is more stressed and forced, they are more likely to then develop that gene or that disorder. So, for example, if you have a gene for schizophrenia, or you've had a historical generational impact of schizophrenia, and your environment is very stressful, the amount of stress you're carrying and the way that stress impacts your body will then make you more likely, for example, to then develop the symptoms. So I think it's really important to understand research, for example, looking at genetics, but also environmental factors such as stress, and how the more stress you have in your life could then impact the mental health disorders or your mental health symptoms. If we then have that understanding, we can then put things in place to reduce the amount of stress we have. Obviously, everyone experiences stress, and different situations can impact how you perceive it. But if you know that you need to be in a less stressful environment, you can then put protective factors in place. You can then put boundaries in place to then help you kind of regulate your emotions, and also kind of have that support system around you as well.
What are some key findings from twins in adoption studies that shed light on the relative contribution of genetics and environments in mental health conditions?
Yeah. So there's a lot of studies that were done many, many years ago looking at twins. So there was a lot of unethical studies that were done with twins, where sometimes twins were separated, and they were tested very differently. So you would have one twin that had a gene for a disorder, and researchers would look at how their upbringing impacted their symptomologies or their symptoms. And oftentimes you can have twins that, because often people research twins because oftentimes twins obviously share a lot of the same DNA, but also twins tend to be brought up in a very similar way. That's why you'll have twins that are dressed in the same clothes, they have the same friendship groups, they are treated pretty much the same by their parents as well. So it's pretty much two identical people. So it's quite easy to therefore research how mental health, for example, is shown in twins. And that is oftentimes where you can have two twins and you'll have them who have the same diagnosis, for example, oftentimes experience it very differently. So I know that there is research that has been done looking at twins who have schizophrenia, for example, and oftentimes have had very similar upbringings and therefore been exposed to very similar traumatic events or kind of substances and therefore experienced schizophrenia. And oftentimes I was speaking to a clinician actually, and he kind of mentioned that some of the twins that he's worked with before have very similar delusions. So kind of their way they perceive certain things in life is very similar. They might also hear similar voices as well. And I think it's quite interesting when you research twins to understand how environmental factors can play a role in people developing disorders as well. And I think with twin studies, twin populations are quite individual. So oftentimes it's quite hard to generalize that to the wider population. But if we can see how two people with similar genetics have experienced a mental health disorder or an illness, oftentimes it can therefore shed light to the role that environment plays. And that is why you can sometimes also have twins where one twin has been diagnosed with a mental health disorder and one twin hasn't. And that will therefore show that it's not based on their genetic makeup, but therefore something that has happened in their environment to understand why one twin has developed symptoms and the other twin hasn't as well.
How do certain genetic variations interact with specific environmental factors to influence mental health outcomes?
Yeah, so oftentimes you can have obviously the gene for certain things, and environmental factors such as your diet can impact how likely you are to experiencing those symptoms. So know that there's some kind of disorders or physical illnesses out there, whereas the diet can play a massive role in how you experience those symptoms. And oftentimes people will change their diet, remove, for example, dairy or high fat in meat, for example, because that can really help them reduce the likelihood of developing certain disorders. And I think it's quite important to look at people's environment and how that impacts them to therefore understand how you're more likely to be expressing symptoms as well. Obviously, this is not kind of my research area, so it's very general kind of views on this topic, but I know there is research out that looks at the link between the two.
Do you want to skip the gene section?
That would be helpful, yeah, yeah.
Perfect. Um, so, which section do you feel comfortable starting from?
Let me have a look. I think I can speak on any of the sections. It's just the gene section that is not kind of
Yeah.
my research area, but everything else that's fine, yeah.
Okay, perfect. So, what are emerging treatment approaches to mental health that shows promise in improving outcomes?
Yeah. So one kind of emerging kind of area is looking at evaluating clinical interventions. So looking at current interventions that are being run by the NHS and how that's impacting people's mental health. So, for example, looking at family intervention with people with schizophrenia psychosis, evaluating the actual clinical impact that intervention has on people. So that would look like interviewing therapists who are actually delivering the intervention to looking at how their training as a clinician has helped them deliver that intervention, what works well. Is it that we need to have more interventions in person or online? But also asking service users as well, those evaluation forms or those exit interviews where we're actually interviewing people to understand their perspective as well. So there's a lot of research looking at evaluating current services that the NHS are delivering to patients to understand their effectiveness. And with that information, we can then create more adaptations to therapies, for example, or drug trials, or just the referral pathways through the NHS or kind of waiting lists to then understand how we are creating a better service that can help people.
Can you discuss role of technology such as virtual reality or apps in delivering innovative mental health treatments?
Yeah, so there is a study at the moment which is called Avatar, and this looks at people with kind of psychosis. So these are people who often maybe hear voices or maybe see things that other people don't see, and looking at how we can create a virtual reality of that experience. So oftentimes in this research project, they create a avatar, so an avatar or a cartoon of that voice that people hear. And I think for those people, it's helpful to be able to visually understand what that voice looks like in a person. So oftentimes people with schizophrenia who hear those kind of auditory hallucinations, so those voices, it's a voice in their head and it's not necessarily a person or a physical person they can see. So oftentimes it's very hard for them to be able to understand what is a real voice and what is kind of a hallucination. So studies such as Avatar, where they've used AI and kind of virtual reality to actually create avatars of these voices. So they work alongside a service user to create a virtual reality of this voice, and they can then actually speak face to face that voice, so they can put a face to the voice basically. That has really helped people to actually understand the voices and be able to differentiate between a real voice and a kind of hallucination. And I think research projects like Avatar, where we are actually using virtual reality, is can be really helpful with people to understand their mental health, but also the impacts that it has on them. So for some people, creating virtual reality of a voice that they hear is too much for them and it's not the right intervention for them. And this is why we have to remember that there is research out there, there is therapies out there, but oftentimes it's not about adapting one intervention for everyone. And I think using this virtual reality can be very helpful for certain people. And the Avatar study is showing that within their findings and research as well.
How does the concept of personalized medication contribute to more effective and tailored treatment approaches in mental health?
Yeah, so I think oftentimes when we're looking at medication, understanding that medication works differently for everyone. Everyone has their own body chemistry, their also functions, but also their environmental factors and genes as well. So oftentimes when we have clinicians such as psychiatrists who work on a caseload of participants or patients, service users, it's really important to understand that person's genetical background, so their blood type, also any physical impairments, but also mental health disorders as well. And when you kind of have that understanding of that person holistically, can then help psychiatrists or doctors create more of a individual kind of medication or drug type, understanding how, if for example, if someone has a diagnosis of schizophrenia but also has a diagnosis of depression as well, understanding how those two medications will impact each other, because oftentimes medication side effects can increase the likelihood of your depression symptoms. So really understanding those kind of chemical imbalances can help people create more tailored medication that helps with the symptoms as well. So I think it's very important to understand the benefits of medication, but also understanding how different medications and the role of your diet can also impact your mental health recovery.
Can you discuss the role of neurofeedback and brain stimulation techniques in the treatment of mental health conditions? And how do these approaches work? And what are their potential benefits?
Yes, I think oftentimes with brain kind of studies and kind of those kind of scans, it can really help people understand from a biological perspective how mental health can impact people. So oftentimes you might have seen pictures of brain scans from people with different mental health disorders, so kind of anxiety, depression, schizophrenia, bipolar, those type of things, and understanding what part of their brain is actually impacted. So oftentimes when you do more brain scan research, you can see what areas of their brain are maybe a bit more low functioning, but also high functioning. So oftentimes with people with depression, oftentimes those areas around the brain associated with mood and emotions can be a lot more low functioning. And when you be able to see more kind of impacts on that can therefore help people create more interventions and help people create more drugs that can help people. And I think oftentimes with brain scans, it does give you that medical, robust kind of brain imaging that can help people understand that, which can be very helpful for some people to help more understand that more neuropsychology or kind of that biological pathways to how mental health disorders and environment can actually impact the brain functioning as well.
Can you provide examples of innovative treatment approach that integrate both pharmacological and non-pharmacological interventions for mental health conditions?
Yeah, so there is research currently kind of in the sector that I work on that are looking at more kind of intervention based procedures. So you have obviously the Avatar study that is looking at using virtual reality to create a virtual character of people's voices that they hear. You then have kind of a family intervention methodology. So that's looking at the role of the family and how we can have that shared learning involving families in people's therapy rooms to help them kind of understand their mental health, kind of having that educational background, and that can really help reduce the stigma. But then, as we are aware that some people find interventions and that therapeutic methods really helpful for their mental health recovery, whereas some patients they find it very helpful to have the medication. So there are research looking at different medical models and looking at how the impact of certain medication can help. Because a lot of the times with mental health medication or that psychotic kind of medication, oftentimes they have a lot of side effects. And I think that is what puts people off taking medication often sometimes, or for example, medications like the injections, so like the depot injections, oftentimes that injection what people have every maybe 3 months, 6 months, that can also have impacts on their mental health as well. So there is research in both kind of pharmacological methods, but also non-pharmacological interventions that are showing positive impacts for both people with mental health disorders and also kind of physical disorders as well. And as we've known as researchers, it's important to understand that people are very different and what works for one patient might not work for another as well.
Can you elaborate on the concept of stepped care models in mental health treatment? How do these models ensure that individuals receive the most appropriate level of care based on their needs?
Yeah, so oftentimes when people are given a diagnosis, you'll oftentimes be assigned to a clinical team, and your mental health diagnosis and kind of what you're experiencing is assessed by that clinical team. Oftentimes, for example, if you're in a psychiatric unit, you'll have systems in place to really help you with your mental health. So, depending on the severity or kind of how ill someone is, will therefore impact how much intervention and support they get on a ward, for example. And oftentimes, people on a ward will have maybe a nurse that's allocated to them. So they're assigned a nurse who works with their medication, also helping them get some interventions on that ward, kind of therapeutic models. And as a NHS service, we are trying to become a lot more kind of interventions, getting more interventions in the ward settings because for many years, oftentimes wards were very associated with a lot more medication and the less more therapeutic methods. And oftentimes people from who get that a lot of support in that care system, so your psychiatric units, your inpatient settings, oftentimes when they're discharged, they find it quite hard to engage or kind of interact with the community because they've been on a ward, for example, for such a long period of time. So that is why we have community treatment orders, where after you've been discharged, you then have a system in place where you have a regular contact with a care team in the community. So they will help you with your care needs, for example, assigning you with a care coordinator or a support worker, for example, who will be coming to your home, helping with your medication or kind of giving you access to therapeutic methods, but also kind of alternative treatments. So I know, for example, in Manchester, we have kind of art therapy, we have more kind of gardening therapy as well to really help people with that systematic change as well.
So how can we challenge Eurocentric perspectives and embrace diverse knowledge systems to ensure more inclusive and culturally relevant approaches?
Yes, I think it's important from a mental health researcher background to understand that a lot of the research and kind of interventions were based and created in a time period that didn't look at culture. So oftentimes interventions that are currently being delivered or therapies were created by white males from a middle class background who had no experiences of any mental health disorders. And I think it's very important as researchers and as clinicians to understand the background of that theory and is that culturally aware, culturally diverse. So oftentimes in the research project that I'm working on now, we found that family intervention did not look at culture at all. It was not delivered in a culturally sensitive way, looking at how the role of culture can impact people's mental health, because oftentimes interventions, the structure of them don't consider how, for example, racism can impact people's mental health or kind of those microaggressions, those kind of how they impact people's mental health. So I think it's very much important to understand the theology and that theory behind that intervention, but also is this culturally adapted? Would this intervention work for people from a cultural background? And I think it's very important to have that collaboration, that co-production that we discussed around kind of understanding more culturally sensitive ways. Because understanding that oftentimes an intervention that has been created from the sole purpose of looking at the global majority perspective, so kind of white backgrounds, is very different to how mental health is expressed in Black populations. So I think it's very important to have that cultural awareness and that sensitivity and using that understanding to adapt interventions, adapt kind of treatments that we are currently giving service users, patients in the NHS.
Can you discuss the role of power dynamics and privilege in mental health research? And how can researchers navigate these dynamics to ensure the marginalized voices are heard and respected as well as represented?
Yeah, so oftentimes when it comes to research, when we're doing research, whether it's qualitative, so those interviews, or whether it's quantitative, that kind of questionnaire based, it's it plays down to who is more likely to access these interventions or this research. So oftentimes you'll have convenient sampling, and that's where you use a sample that is convenient to you. So that might be going out in a clinical setting and handing out questionnaires to people in a ward. So oftentimes, if you're using that type of sampling method, you're only going to get people who were on that ward on that day. Therefore, once you do your findings, is that then generalizable to people who were not on that ward on that day? So I think it's very important to understand that when it comes to power imbalances in research, oftentimes people who are more likely to take part in research are people who have time. Oftentimes, people who are maybe a single mother, for example, working multiple jobs and might have a diagnosis of depression, for example. Even though she would find it very helpful to be involved in research because of her busy schedule, she's less likely to be invited to take on research projects or have the time to do research projects.
So looking at how oftentimes you will get a certain type of people who are taking part in research. Oftentimes you're going to get people who are more open about their mental health. So they're accepting of their diagnosis and therefore more likely to see the importance of mental health research. But oftentimes you're therefore going to also get people who actually understand English, for example, if you're doing research in the UK. So therefore, you would be excluding a whole population of people who might not be able to read English because maybe English isn't their first language. And if you don't have systems in place, such as interpreters, you therefore exclude a large amount of people who English isn't their mother tongue. So I think it's very important to understand that research, even down to how it's studied, needs to be accessible. Understanding to have interpreters in place, that might be a beneficial kind of structure, but also understanding that oftentimes English cannot be interpreted into different languages, how it's written in plain English. And I think understanding that will therefore allow researchers to understand the cultural biases that are in research and the power imbalances. Understanding that, as we've mentioned, the importance of cultural sensitive methods and researchers and clinicians being a bit more culturally aware, but therefore understanding the barriers that people from those cultures face. For example, they might not speak English, they might have a lot of stigma, therefore might not feel comfortable to get involved in research. But also if they have issues with even accepting their diagnosis. If someone from a cultural background doesn't accept their diagnosis and they see a post that says, do you have schizophrenia? Would you like to take part in research? To them, they don't have schizophrenia, even if they've been given a medical diagnosis of schizophrenia, and that therefore they'll be less likely to then be involved in research. So when it comes to research, the power imbalance does tend to come to the fact of you might be recruiting people from more affluent backgrounds who have had that academic background, so they see the importance of research, but also more likely to speak English, might have more time on their hands. And we really do want to make sure that research is inclusive as well. So really understanding when you're developing research or in a research trial, what things have we put in place to ensure that everyone's voice can be heard? And as you mentioned, kind of not ignoring, not diluting voices of populations that are often not researched.
Can you discuss the ethical considerations in conducting research with vulnerable populations and how can, researchers ensure that their work respects, let me say that again, sorry, I do apologize. Can you discuss the ethical considerations in conducting research with vulnerable populations? How can researchers ensure that their work respects the rights and autonomy of individuals whilst addressing the unique challenges they face?
Yeah. So when you're kind of creating research, a research project, you have to go through ethical kind of considerations. So you have to create a ethics kind of application. And in the application, it's quite a long application, and it breaks down how you as a researcher you are considering ethical implications of your research. And we are aware that when we are doing research on people who are under the age of 18, who have a mental health disorder, they are classed as vulnerable people. And just because they are classed as vulnerable people doesn't mean that we shouldn't do research on them, because it's, as we know, it's a very important group of people who need to have access to research. And if we have more access to research on vulnerable people, we can therefore help the services that are currently in the NHS. So I think it's very important to, as we mentioned, to understand the implications of doing research with vulnerable people who've experienced mental health disorders. Oftentimes, as people have experienced a lot of trauma, a lot of kind of stigma, a lot of stereotypes, a lot of kind of maybe even racism, physical abuse. They've experienced quite a lot of harmful environmental impacts. Oftentimes, we need to understand, if we're doing interviews, how that will impact them. So as I mentioned, we don't want to be even though it's important to understand people's experiences and lived experiences, it's about how can we ask those questions in a non-traumatic way? How can we ask those questions in a sensitive way that we can still, as researchers, learn, but also allow the people who are being interviewed that space of self-awareness and allowing them to also understand their experiences as well. So I think it's important as a researcher to understand what you're doing as a research, but why is it needed? Why are you choosing that methodology? Is there a better methodology that could be a bit more sensitive? So oftentimes when you do questionnaires, you can use that as a more sensitive kind of option to research an area. But oftentimes certain projects need to be done by semi-structured interviews. And having those semi-structured interviews is where you'll have kind of an interview guide, but you allow that service user, that participant, to shape their answer. You're not trying to mold them into answering a certain question. So I think with research, as I mentioned, the funders have seen that it is very important for us as researchers to have ethical consideration. So that is why we go through quite a long ethical application where we list all the ethical implications that could come of our research and what systems we are going to be put in place to overcome those barriers. And once those kind of funders are happy with that, that is when research is passed and kind of being agreed that it can be run as a research project. So we do see the importance of having that ethical consideration in our research, but also having that self-awareness of what we can do as researchers to protect and overcome those barriers as well.
How can we ensure that future mental health research is inclusive and representative of diverse population?
Yeah, I think when it comes down to ensuring that research clinically is kind of understanding diverse backgrounds, it's really important to have this method of co-production and using people with lived experience to help you shape your research. That is why when we are requesting or kind of applying for research funding, there is people so there's a panel of experts. So these are people who have got an expertise in that field, but also we now have people with lived experience on that panel. So anytime a researcher is applying for funding to do research, they have to complete an ethical application, kind of outlining their protocol. So what is their research? What will they be doing in their research? And then they also have to go to kind of a review meeting where there's a panel of people. It's kind of done in person or online, where you have to basically explain to this panel what your research is, what do you aim to find from it, what will this research help with the current interventions that are being delivered in the NHS. And on that panel, we do have people with lived experience. So allowing people to be in funding meetings, being on the funding panel, who have actually had lived experience of mental health allows it to be a bit more representative of research to understand that is this research relevant to someone who has experienced mental health. And I think having people with lived experience more involved in research can allow us as researchers to understand it from a lived experience perspective, but also allow people with lived experience to also understand a researcher's perspective as well. And it's really about that collaboration. And that's why as researchers, for example, myself doing a PhD, it's very important and installed in us from PhD students that we need to be working collaborative with our colleagues and having open spaces where we discuss our research so we're not biased, and we have kind of external reviewers and we have supervisors who really help researchers have that collaboration, that space to discuss their research to make sure it is representative of the population as well.
Perfect. That was beautifully explained. What steps can researchers take to translate their findings into practical interventions and policies that positively impact mental health outcomes?
Yes, I think when it comes to research, obviously there's different stages of research. So you'll do your literature review, and that's where you review all the literature out there on that theory or that topic that you're looking at. So for example, let's say you're looking at anxiety and COVID and how that COVID has impacted anxiety. Oftentimes you will, first step is to review the literature on those two keywords, those key themes. Once you look at the literature, it will then allow you to see, well, what current interventions are currently out there, what theories are currently governing that kind of therapeutic background. And once you have that understanding of that literature, you will then be able to see the gap in the literature and what needs to be researched. From that, researchers can then see which is appropriate methodology to use on their research projects as well. But then also understanding the types of sampling, so how they're going to recruit their participants onto that research project. And I think when researchers understand the systems in place, they can then create more of an aware project that's more inclusive, but that's also relevant to the structures as well.
How can we encourage collaboration and knowledge sharing between different disciplines to foster innovation and advancement in mental health research?
Yeah, so I think collaboration is really important in the success of research. So working collaboratively with other researchers on projects is really helpful, but also having more research-based professions. So as we mentioned in the NHS, you will have kind of this new profession of a research nurse. So where we're having people with clinical background of a nurse, also has more of a research day. So they might have one day where they do research as well alongside their profession. And I think it's also important to just have more lived experience groups. So I know within Greater Manchester, there are groups that consist of people with lived experience in them, and researchers can kind of use it as like a dragon's den type of style where they take their research projects to lived experience groups. So these are groups with people from Black backgrounds, ethnic minorities, young people, older people, people with different experiences, and they can help shape research. I think it's important to work collaboratively within your institution. So, for example, the University of Manchester has really good connections with the NHS to make sure that the research that is being researched is actually relevant to the clinical needs of professionals in the service. And when you are kind of creating research, it's very much important to also discuss how you will kind of produce that research, and if you want to make it open access, so allowing people from the local community to access the information, but also how do you make that information accessible? So do we kind of use a PowerPoint style to represent the findings? Do we create a blog post? Do we create kind of a podcast discussing it? Do we create a short kind of webinar? Because understanding that when you work collaboratively, you'll be able to understand the needs that everyone has when perceiving and understanding research as well.
Perfect. Did I ask you the technology question?
Yeah.
Perfect. Sorry. How can we bridge the gap between research and practice to ensure that evidence-based interventions are widely implemented and accessible to those who need them most?
Yeah, so I think it's really helpful to have, when you're developing research, is to work collaboratively with actual clinicians in the service. So oftentimes when research is done, so for example, with our research looking at the role of family intervention, which is a form of talking therapy, how that is used with people with schizophrenia and psychosis, we work collaboratively with actual clinicians who are working in the NHS across the Greater Manchester, but also in London and Southampton and Birmingham as well. So we also look at how the research that we're doing is relevant to those populations. And I think once you start having clinical researchers and clinicians on research projects or helping out with the delivery of an intervention, it can then help us shape how this intervention is used to reduce kind of inequalities or biases, and how this is relevant for the implications in research.
Finally, what's one thing that you're grateful for today?
I'm very much grateful for this platform to just have open conversations about mental health. And I think this podcast is really beneficial, not only for us researchers, but other kind of clinicians, but also people who just experience mental health as well, to be able to listen to something that is not based on academic jargon or kind of big fancy NHS words, but also kind of two people who are kind of passionate about mental health. And I think it's very nice to have more platforms like this where people can openly speak about mental health research, but also kind of people with lived experience as well. So I'm very much a big believer that knowledge is power, and having conversations with people, being able to understand both people's perspective is really helpful. So that is definitely one thing that I'm grateful for.
Thank you so much. I feel like that's my favorite one. And favorite response to what you're grateful for. Thank you so much for joining us on this incredible episode of our podcast, My Trauma's Chronic, but I'm Iconic. We hope you enjoyed our conversation as much as we did. And your expertise and passion truly shines through. I can definitely feel it from through the screen. Your expertise and passion is amazing, and you helped let me say that again, sorry.
It's okay.
My thoughts is very scrambled. Thank you so much for joining us on this incredible episode of My Trauma's Chronic. I'm Iconic. We hope you enjoyed our conversation as much as we did. Your expertise and passion truly shed light on the complexities of the human mind and the importance of mental health research. We want to express our utmost gratitude to you, Shenitta, for sharing your knowledge and experiences with us. And your insights have been truly inspiring, especially when it comes to cultural competency and the work that you're doing. And we have audience have been left as empowered as we have to make a positive impact on the world. As always, we appreciate your support and love having you as part of our podcast community. Stay tuned for more exciting episodes coming your way. Until next time, take care of yourself and remember to prioritize your mental and physical well-being. You're incredible and deserving of all the love and support in the world. Until next time.